This conference will now be recorded.
Hello, everyone, and welcome to the Better Together webinar with Goshen Health and Jump Technologies. Before we begin, just a few reminders. Please mute your telephone. If you are using your computer audio, please mute the microphone on your computer. We will be answering all of your questions, or as many as we can, at the end of the presentation. You may submit questions using the chat feature in the GoToMeeting dialog box. We will make a recording of this session available to you via email, and we encourage you to share it with others on your team. Thank you for your time and attention. Our session will begin momentarily. Good morning, everyone. Welcome to the Better Together webinar that we're doing with myself, Steve Heintze, and with a gentleman by the name of Seth Geiser from Goshen Health. We are going to be talking a little bit about the journey that the folks at Goshen have taken to strengthen and reimagine their supply chain. But to get started, I just wanted to tell you a little bit about myself. As I mentioned before, my name is Steve Heintze, and I am Vice President of Sales here at Jump Technologies. I've been with Jump for a little over 3 years now and have been in the healthcare business for approximately 30 years now in a variety of functions, always over on the vendor side, selling into hospitals and the healthcare systems in general, everything from disposables, devices, to capital equipment and service of that equipment. So this is my first foray into the data side of the house, and we're very excited here at Jump because we see a lot of opportunities that are out there to help all of you become better or reimagining your healthcare supply chain. So that's enough about me. Let's talk a little bit about what's been going on in the marketplace. We saw, due to COVID, the healthcare supply chain literally collapse for a variety of reasons. When we think about the supply chain, I like to think about it in terms of individual links. And that healthcare supply chain really is consisted of the raw goods sourcing, the manufacturing of those goods, whether that be onshore or offshore, the distribution side of the supply chain. The government certainly factors into that and has a piece of that supply chain. And lastly, what I believe to be the most important part of that supply chain, and that's at the hospital or the end user link, where we really need to do a better job in managing both the consumption and the demand associated with the velocity of goods flowing through your facilities. So what did we see with COVID-19? The real impact moving forward has been very, very significant. I don't need to tell all of you, but just briefly, this lack of PPE and ventilators, a variety of different products, really put patients and staff at risk, and it created unnecessary deaths. We want to make sure that we can do something so that doesn't happen again. There was a lot of canceled services. This cost the hospitals that were already running at very low profitability margins, some underwater already before this, to shut down all their elective procedures. And for some facilities, that can account for as much as 70% of their revenue. So it literally has cost hospitals millions and millions of dollars, and quite frankly, has compromised patient health. A lot of those elective procedures, a lot of things that didn't occur resulted in some bad things for patients. So that's been a big impact that's come of it. We shut the country down, and that's cost us trillions of dollars in debt that quite frankly, we don't have. And we've seen unemployment at an all-time high and businesses failing. When we initially started talking to hospitals, we asked what we felt were 4 simple questions, and that literally was, what do you have? Where is it located? Who's using it? And when are you going to run out? And it was very, very difficult for the hospitals to very easily and quickly answer those questions. And we feel that that's contributed significantly to an absence of data visualization. That ability or inability to see your data and do something with it really, really contributed to some of the problems that were out there. Point of use solutions in the marketplace are at best cumbersome and time consuming. The Meditech solution that the folks at Goshen were using is a perfect example. There is no point of use data collection that's occurring. And it does allow for a lot of folks to start making impression or opinion-based decisions. It's very difficult, very time-consuming. Reporting is an extremely manual process. When people looked at those 4 questions I asked before, they were having to report this all up to the C-suite, to the state, to a variety of different entities. And it was an extremely manual process that involved downloading multiple spreadsheets, merging those spreadsheets, and trying to make sense of that data that resided in their ERPs, but it was very difficult to do. It has allowed for hoarding of supplies. And if you think about hoarding of supplies by clinicians, what that really is, it's just a lack of trust in their supply chain's abilities to provide them the products they need and the amounts they need in the time and place they need. So hoarding definitely has been a result of data visualization issues. And then I tell you the last thing is, as I mentioned a little bit before, is it really leads to opinion-based inventory management. That's fraught with things like human error. You have multiple sources of truth throughout the facility, and it creates what we refer to at Jump as a data divide, meaning the clinician has one opinion as it relates to the amount of supplies and what supplies he or she may need. And that supply tech also has an opinion because they've been filling those storerooms forever and they know exactly what needs. The point is, there's a lot of sources of truth, and this has resulted in an absence of neutral data visualization capabilities. So, what are we going to do about that? We've developed what we refer to as the 7 steps to reimagining the supply chain, specifically as it relates to that last link for hospitals. The first step in this is really critical, and we will sit down with hospitals and we will make recommendations based on what we see as best practices in the market to include what's the best methodology. Do you want to do par replenishment? Do you want to do perpetual, cycle count, Kanban? We will review all that with you, and then we'll make recommendations. What's the best technology that needs to be in place in order to do that properly? So the assessment is the first step in really understanding where we are and where we want to be. The next step is around data capture. And data capture is really critical. It's designed to be neutral, it's designed to be easy to use, and it's designed to eliminate the tribal knowledge that's running rampant within our hospitals today. So data capture, good, clean data is critical in terms of reimagining the supply chain. Once you're sure that you've got good, consistent data capture, then you're going to need to get into the next phase, which is the basic visualization. I had mentioned earlier in the talk today that those 4 questions, what do I have, where is it at, who's using it, and when will I run out? That's basic visualization. And at step 3, hospitals will be able to do that without downloading multiple spreadsheets, without crunching all those numbers, without taking man hours up to try and really visualize and answer those 4 basic questions. Once a hospital can do that, and they've been doing that for a while, generally around 90 days, they're ready to step into the forecasting and adjusting area. This is what allows you to start forecasting your needs with your distributors. This is what's going to allow you to start making adjustments to your PARs so that you don't have too much sitting idle in one area, too little in another area, running stockouts. We have a variety of reports that allow you to monitor how your forecasting and adjusting is taking place. Everything from stockout reports to PAR calculator reports, a couple of which we'll review a little bit later on here. Once you've mastered that, then it's time, we believe, to move into your procedure areas. The procedure areas tend to be one of the more expensive spends we have in the hospital, and there's a whole lot of manual process and things occurring. Our focus and our hospital's focus when they look at the procedure areas is how are we going to clean up our preference cards? Preference cards have been a problem for hospitals for a long time. pulling products that aren't being used, throwing those products away, or having to restock those products. Standardization issues. Have we standardized around the vendors that we decided were best for our facility? Have we standardized around the processes by which those products are used? The inability to see what's occurring in those procedure areas can allow for a lot of cost overruns. We can also help you with assuring that all the products that are coming into those procedure areas are currently on contract, that they currently reside within both your EMR and your ERP, charge codes, things of that nature. So that's a step that comes next in the process. The next step is being able to visualize that data, being able to drill up or down on your data to understand exactly everywhere from a category to an individual item, where everything is across your health system. Do you have enough gowns in a particular unit within your hospital? Do you have enough gowns in your entire health system? Do you have too much in one place and not enough in another? The ability to look at your data across, up and down your entire health system, being able to drill up or drill down is critical. So that's what we address in step 6. And then lastly, data sharing and collaboration. We saw scenarios whereby the federal government was bidding against the state government, who was bidding against the hospitals around getting things like ventilators and PPE. The lack of data sharing up and down that chain back to the state and federal agencies contributed significantly to the problem. And we believe that good, solid data being shared up and down the supply chain, going to government entities, going to distribution, going to manufacturing, will be critical so that we don't get into this type of a position again. So what are some of the ways in which we can capture that data on the very front end? It's got to be easy and it's got to be point of use. It's got to eliminate or minimize any human intervention. And we have a variety of different tools that allow you to do that depending upon the type of inventory methodology you've decided you want to use. An example here in the very bottom, this is the type of product, the key fob that you see down here is what the folks at Goshen are using to manage their Kanban. It's smart technology. It's about the size of your key fob for your car. You simply point and scan the barcode. That then will beep, letting you know you've done it. You can't double scan bins. It won't allow for that. So it truly gives you a real picture of what's being consumed and what you need to refill. The other devices you see up here allowed for a variety and will support a variety of different methodologies. But the thing they all have in use is that they're very easy to use. We purposefully made our software work on Android and iOS devices because we know the market and the people who are using them are familiar with those devices. They know how they work. So this isn't anything that really should be real new to your people, and we can get them up and running very, very quickly. The other thing that all this easy point of use technology begins to do is it begins to eliminate this opinion-based supply chain. The data is what the data is, not what somebody thinks it should be. So if we're collecting the data in the proper way, now what we've got to be able to do is to see some reporting and to visualize your data, if you will. What we have here is a current inventory report, and that report will be able to drill down and show you by account, by item number, by location with that account, and you can do that either by item or you can do that by category. And what it will do is it will allow you to have good visibility. Anywhere that you've got a Wi-Fi connection, you can pull this up on your phone or any other device you're working with, and you will be able, with a click here and there, to be able to see exactly what I've got, what that unit of measure is, what's on hand, the on-order use unit of measure, your average daily uses, and from there, you're going to be able to see what your days of supply are. By drilling down and looking at different facilities and what these days of supply are, it can allow you to begin either transferring products out of one slow-moving area to a fast-moving area, or from one hospital to another hospital. So the ability to do this without having to download multiple spreadsheets, taking the time and doing all the analysis, by the time that all that is pulled together, the data by which you're looking at may already be expired. It may not be good. So visualizing your data in an easy, accurate way is one of the keys to the success. But it's not just about visualizing the data, it's about actually being able to do something with it. Our PAR calculator report, which is one of our more popular reports, once again, it's on demand. You simply go in, you decide on a location you want to see, what that supply source, pick a date range, run your report, and it will show you all those items that you wanted to see. Then through drop-down screens, you can either edit your days of supply, you can edit your safety stock, you can edit your PAR levels if you choose to. And in this particular instance, the savings opportunities on the far right that are in green show you that you're overstocked. And if you were to make PAR adjustments, you could take that much inventory off the shelf, freeing up that cash for other things. So the actionable nature of our reporting is critical because it allows you very quickly, if you have the administrative rights, to go in and make changes to your PARs so that your PARs begin to more accurately reflect what it is that you're going through, as opposed to what your people think you're going through. So that's a quick download on our reporting, the actionable nature of that reporting, the ease of getting that reporting. All these things are critical in terms of being able to visualize your data and do something with it. At this point, what I'd like to do is turn the floor over, if you will, to Seth Geiser, and I'll let Seth introduce himself, tell you a little bit about himself, a little bit about Goshen Health, and share what Goshen's experience has been like in moving along these 7 steps. So Seth, it's all you.
Thank you, Steve. I'm Seth Geiser. I've been at Goshen General Hospital for 14 years. I am in the current role of Materials Management Information Systems Specialist. We've started off with Meditech Client Server, and I was just recently, just a couple of years ago, we went upgraded to Meditech Expanse. We are just a small organization that is just in Goshen, Indiana, which, if you were to look on a map, we are about 3 hours east of Chicago. We are still an expanding hospital. We have plenty of clinical sites off-site as well, and then, yeah. So we're still ever growing, and we're just a small place. Next
Let's
slide.
talk a little bit about what you were looking at before you got involved with Jump, Seth. So I'll let you kind of walk us through this slide here.
Yeah, the very first thing I would like to go over is what we used to have before Jump, which, back up a little bit, is that we're using the Pyxis machines as our form of supply chain restocking up on the units. We've learned that just within that there was misordering or too much ordering, and then which included things stocking out and or expiring on the shelf. So we ended up changing over to replacing that system with the Kanban system with a par level for each bin. That ended up bringing some down on the value and the amount of items that are up on the units. But the problem that brought in versus compared to the Pyxis machines was that it increased our time of scanning. And the way the Meditech scans has a lot of steps. It took time, and it took more to learn and teach a new colleague on how to do it, just because there's so many different clicks, and at the same time you have to manually enter the par number into Meditech while you're creating that.
So did that human intervention, the extent of that, did that drive a lot of, I don't want to say a lot, but did that drive a fair amount of human error, or at least open the door for that?
Yes, it really did, because it ended up bringing whoever's doing the scanning decides how much it's going to go in the bin.
Got it.
And that ended up overstocking a lot of items that in the end we really didn't need to be overstocking. That's where the reporting would come in, where it trying to pull a report out of Meditech was always a time process, and what Meditech has to offer really did not give us a real clear picture, and we would have to manually um, create formulas, and we even had to go out and we kind of hired someone to help us create formulas to put that data to a usable use for us to use when we did the Kanban system.
So is it
And
fair to say, Seth, excuse me, was it fair to say that there weren't a lot of people who really knew how to run those reports? It was a select few. Is that fair to
oh no,
say?
it's the only people that really knew the reports had to have a lot of training and have a lot of experience within Meditech to understand how it operated, to fully understand how Meditech reports out in their reporting.
Gotcha.
And that took, so there was only just a select few. So if that few was out for a while or gone, for the most part there was no movement or any reporting going on.
Kind of getting back to that institutional knowledge and all these different, if you will, sources of truth, right?
Yes.
Okay. So once you got those reports, were they actionable? I mean, how difficult was it to then do something?
Well, it really depended on what you wanted. We came across a lot of data that we wanted, but it required um, pulling two reports, like you were saying earlier, pulling two reports and then throwing them into an Excel sheet and combining those two reports just to get at the data that we're actually requiring or is required from other colleagues within the organization, which that ended up increasing a lot of time and effort to make that happen.
Gotcha. So let's talk a little bit. Let's tell the audience a little bit now about what Goshen's journey to success has been, and kind of walk us through how these different steps have gone for you, and what you all have done and where you're at.
Yes, for the step one, it was a pretty simple and easy start. Um, you guys came down to make a visit on site to physically see what is needed or what suggestions that we could do to change how we are doing things for the better. Once that was done, we had our custom assessment, and we decided to move forward with it. And within that, it ended up including things where, with the scanning part, definitely we started seeing that benefit of using JumpStock for scanning versus Meditech almost right away. As soon as we launched our first unit with that new system, we've already noted it was already just from that was saved 10 to 15% time from scanning, and it eliminated the opportunity for a single colleague to decide how much should go up versus letting the PAR system do what it needs to do for us to make the educated decision. Yes, we do, or no, it just seems like it, but you're really not using that much. And step two, that kind of that falls right into the implementation of the Kanban. Now we are able to physically see. We've already started making already making some changes due to the data that we've had. We have implemented about 90% of our units with the JumpStock Kanban system.
Tell me
And
real quickly, if we could just stop for a second, how well, if you were to compare the scanning and the fob that you all are using for your Kanban data capture, how does that compare to what you were doing before?
well, how's that compared? It's basically a 180. The simpleness, it made training new colleagues a lot more easier for them to learn, a lot more faster to submit the orders. With this, with beforehand, like I said, you had so many steps with Meditech, where with JumpStock, we went from, I know it was in the tens, of steps, but we were able to bring it down to just about 4 or 5 steps, and that is it. Just to from starting to scan until the order is in the system and ready to be pulled.
Great. So you've tell me about how you got this 90% compliance. Is it the customer, your employees just like this system better, or what really drove that for you?
We What really drove that was, like I said, we were already starting to see after our first inventory that we ended up going up, that we saw the need to move quick, so that way we can start realizing our savings and our data a lot more faster, which in turn allowed us to start making decisions on, do we really need this up there? Do you really, which in turn from there led us to bringing down our stock and our actual storeroom, which in turn, again, that domino effect of, you save a little here, it has a domino effect to where now we're not having to purchase as much items as we once did, thanks to
Great.
the Kanban, and be able to see, okay, well, you guys have 6, but the data shows that you only need 2 because you only use 1 every month, versus the other way, which also we end up finding out that we're having less expired products on the shelves, on the
Fantastic.
units, than we did before.
Very good. So, but you guys aren't done yet. Tell us about what you're envisioning around these next steps around your journey.
Oh, we are definitely envisioning to hopefully be fully up and running on all units by the end of the year, and then also and start doing more adjusting and having more of that forecast after the 90 days, which is a really good starting point. And then step 5, we are shortly right after that, we're going to work with the OR, and getting that up and running, using also JumpStock as the reordering for the storeroom for their items as well. So we'll get them set up as a Kanban system as well. And then we are planning to bring other areas into the Kanban system because of JumpStock, that we weren't able to before. So that's really promising, that we're looking forward to do.
Good.
And then hopefully, once everything's set up, we start getting all things going. We're hoping to maybe get this, maybe start extending this out past the hospital, as the outbuildings only use what the eyes see type ordering, where they don't have, how much do I really use? They just look at a closet full of items, and then that's how they use to order. So we're hoping to be able to implement the system along the lines to help bring that down. And then also, like Steve was saying, with that reporting, we can see, who has what, if we were to have a back order or an allocation. That especially for right now with what we're dealing with, in this day and age, this year, that would be very helpful, and that would be just an awesome tool to be able just to see who has this item, who can we kind of borrow from if we needed to. And currently, right now, we just don't have that ability when it comes to the outbuildings.
Okay, great. So, well, first of all, thanks so much, Seth, for kind of sharing with us where you were, where you're at now, and where you're going, because it is a journey, and it's just not like I'm going to get this new scanner and I'm all good to go. So That being said, I'd like to now go through some of the questions that have come in. Thank you all out there for your questions. And Seth, the first question we got, if the JumpStock reporting is better than what you get from Meditech, how is that and how has it helped you?
JumpStock's reporting is so much more simpler and less clicks to do. And one of the greatest things that I really enjoy with Jump Technologies reporting is they have, you go on their screen and you get the report brought up that you want. All you have to do is on their site, on their page there, is click at download Excel, or you can download CSV, and it automatically downloads everything into an Excel sheet, and it's already done and ready to manipulate or see what you want to see, or send to, say, you need to send to another colleague to show the data to make any data-driven decisions. And it's just that simple compared to Meditech, where you would have to really comb through it, and then you'd have to do all sorts of multiple things depending on what report, depending on what data that you're looking for. Where with Jump, all it is simple. Bring up the inventory, all the way down to the item, and you can just do a download straight from there into a regular Excel sheet and then send it off to whoever's requesting the data. And that has helped alleviate a lot of time spent on reporting, which gave us more time to work on other things. That is pretty important as well.
Great. Another question that just came in is, has JumpStock's mobile scanning app made your staff more efficient and allowed you to have better data capture?
Oh yeah, that the scanner is such a simple tool. It's way more better than taking, because what we were currently using was just a laptop on wheels and a handheld scanner attached to it. And the one of the major things that made it tedious was within Meditech is you have to go in, scan, do all the work for each and every single inventory. Where with the JumpStock key fob, it actually makes it to where you can scan multiple inventories at one time without doing anything. You just scan it, dock it, and it creates and separates the orders as you scan them. And that has really created a lot more time for our colleagues to spend more time to clean shelves, check expiration dates, which in turn we have been able to catch more stuff about to expire than we did before.
Fantastic. Last question I have here just came in. How has the integration between JumpStock and Meditech worked for you?
It has worked out pretty well. I will, as with any implementation, there's always still those couple of ruts to get through, but once you get through them, it works flawlessly. It integrates very well. You don't have to do anything in Meditech for Jump. Jump does it all on its own, so there is no work added to get the data from Jump into Meditech in that integration aspect, as in everything happens in the back behind the scenes, and you just keep, and then so all the charging for the GL, even with if you end up going with the InterTrack, which is a really great software that they have as well, will integrate into Meditech as well, and you don't do anything with it, and it's been working out great.
Fantastic. Well, Seth, thank you so much for taking the time today. Just a
Yeah,
couple.
thanks for having me.
Sure. Just a couple closing comments as we move forward. This pandemic took a bunch of products that when we would be out talking to people, they would tell us gloves and gowns, masks, no big deal. We can get as many as we want. They're cheap, easy to use, and all of a sudden they became critical items. We believe that you all deserve the right tools, the right processes, the best practices, best data capture, and then the best reporting and data visualization that you can get so that we can avoid these types of situations from occurring again, because we know that they will. And I'm just not sure if we don't really clean up that consumption and demand forecasting side, that the next pandemic, whatever that might be, isn't going to put us right back to where we are now. So we're excited because the industry is taking a hard look at supply chain. I would tell you, this is the supply chain managers or directors' opportunity to get audience, whether you like it or not, with the C-suite. I think they're recognizing that there are good opportunities to make investments here to strengthen that supply chain, because everybody's seen what happens when the supply chain doesn't work. So thank you all for all the work that you're doing out there. Thank you for your time today. I know you're all very busy. And if you'd like to learn more about how Jump can help you, feel free to visit our website, reach out to us, and we'll have somebody get in touch with you real soon. Once again, Seth, thanks so much. And this will end our webinar for today. Bye-bye.